Good evening. Thank you all for joining us, and thank you so much for taking the time in your busy schedules, and some of you around the world in different time zones. So we really appreciate that you took the time to join us tonight in one of a special event. In Ishte, we are now launching more and more research and education in health and in digital health in particular. Today, we are going to have a conversation with Mr. Clayton Hamilton from WHO Euro. And before actually doing the formal presentation and thanking you, Clayton, very much for your time and your availability, I would like to invite Professor Luisa Lima. She is our president for the Scientific Council and also is coordinating the Ishcare Health area to tell us a little bit about this initiative and societal health perspectives. Thank you, Lisa.
Thank you, Enrique. It's a great honor to be here, and on behalf of ISCTE, I would like to welcome Clayton Hamilton and also all of you that decided to spend the end of this evening with us. It is a great honor to have with us someone that has been leading the roots of digital health all over the world, and it is particularly meaningful for me having you here today because the way you stay in digital health has a lot to do with this idea of ISCTE Health. ISCTE Health is a new project that we have launched a few months ago, and it has looks at health from a societal perspective, a perspective that is at the same time interdisciplinary and looks at the social contexts of health, but looks at in a global perspective and focusing on a digital approach. And the way our guest looks at this digital health is exactly an example to see health not only frame into a biomedical perspective, not only from a technological perspective, but think it is as an holistic perspective that includes well-being and the empowerment of people and the linking to public policies. So thank you very much, Enrique, to organize this, and thank you very much, Dr. Hamilton, for being with us.
Thank you so much. So in terms of housekeeping, you are welcome to send your questions through YouTube channel, and they will be channeled over to our chat here, and I will be making sure we will address them in the second part of our conversation. So do start building up your questions and make sure you write as many questions as you can. And if we can't reply to them all during this 1 hour, we will make sure we will get back to you by email if you give that contact as well. So actually, what we will do is an informal conversation about digital health and about the role of WHO, especially the office in Copenhagen, where Clayton is leading these efforts. Mr. Hamilton Clayton has been the leader and is the leader of digital health flagship program within WHO Regional Office for Europe Division for Country Health Policies and Systems, providing support and guidance on all aspects of digital health and innovation to support healthcare systems strengthening and reform in the region. A region with 53 countries. With a background on ICT development and business management and over 22 years of United Nations experience working in the fields of technology, digital health, and public health. I would go on reading a long summary, right? Commas, a long summary of an extensive curricula. But more of that is to say that I think we've become friends over the years in different meetings in Europe, in different moments. And for those of you that are following us and are from Portugal, I would like to remind you that our first strategy for digital health benefited tremendously from a workshop that happened in September 2015. That was the first time we actually met in Lisbon, and Clayton came with all his bag of knowledge from other countries and told us a few good tips that I think really made a big difference. So Clayton, thank you so much for your availability. And to kick off our conversation, why do you love digital health? And why is an organization like WHO so important for digital health?
Well, thank you very much, Louisa. Thank you very much, Enrique. It's really, the pleasure is mine to be here this evening. And I really look forward to sharing really in an informal conversation, everything that we can about digital health, what we see at the European and the global levels, and really where we see digital health moving from this point on as a result of what the COVID-19 pandemic has shown us. And really where governments of Europe and beyond are actually keen to see it move. So firstly, to answer your question, why do I love digital health? And it's an interesting question, not one I'm often asked. But essentially, I think coming from particularly an IT background originally, I've always seen myself as an agent of change, somebody that has looked at processes from the perspective always of how can we improve them? How can we make them more efficient? And I initially in my career started out working in a number of medical institutions, medical suppliers and distributors. And even at that early stage, although it was a completely different environment, I could see that the benefit that technology was actually bringing to health systems. And we need to remember also that health, when compared to many other government portfolios or industry perspectives, is really quite far behind, I think, in terms of the digitalization. So what this leads me to answering the question, why is WHO so important? Well, firstly, because I think that really it's the only global independent partner that has the mandate and the auspices to actually bring and improve the digitalization of health systems, and a trusted partner for ministries. So WHO itself works one-on-one with the ministers and ministries or health authorities in the world. So it's really us that not only brokers the dialogue, but actually brings the knowledge on digital health to health authorities around the world, and really drives at both the international and the European level, the discussion around standardization, which is a really key perspective. So I'll finish off the answer to that particular question by saying also, it's really noble when you look at what WHO's mandate is and has had since its inception in 1948, and how that mandate is changing in a digital world. And I think that again really speaks to the fact that it's uniquely positioned to ensure that the digitalization and the benefits of digitalizations are spread equitably across the populations of the world. And it's a really, really big point, because there is no other global organization that has that mandate. So it's both a noble, but also an very inspiring motivation to actually work for, and one which I'm happy to say that we're beginning to see more and more success in the European region.
And following up on that, I mean, some of people following our conversation today, there may be either working in a hospital or working in primary care, and often I hear them because I've worked there as well in that setting. And those people working in offices, they're just bureaucrats. They can't change the world. How would you challenge that argument? How would you say that perhaps you've actually changed some parts of Europe a little bit?
Yeah, and it's a really interesting perspective, because you can always, I think, as an individual, question sometimes whether or not you are making that difference. But I've certainly seen from the perspective of how good management, good governance, and strategic investments, in particular the area of digital health, can have real impact on the lives of individuals. Being able to change massive care processes that have essentially stagnated and become inefficient over time, and actually create not only gains in both in terms of the efficiency of the way the health system is working, the reduction of waste in certain cases, but also really about making healthcare more transparent, making it more accessible. And we see evidence of that time and time again working with countries in Europe. So again, like I think many other forms of healthcare, and I really have to take my hat off to the healthcare professionals that have worked tirelessly through the COVID-19 pandemic, putting their lives first to share really their experience and to save literally the lives of many people. We really feel that digitalization is more and more having that impact, that it's been working in the background, but you can really now see the tangible benefits that it's bringing. So to answer your question, Enrique, yes, it can sometimes seem a very distant when you're working in an office and you're actually advocating for more digitalization at the ministry level. You're working on the development of standards, or maybe a tiny little area of a very, very big portfolio. But really, you do end up seeing the benefit over time. It's really about maintaining patience, maintaining the investments, and really working the hardest that you can to actually show the benefits of digitalization to the highest level of health authorities in countries. And we need to remember also and be respectful that they're not technical experts. They haven't had that exposure. They're quite often consulting WHO to say, WHO, we really don't know which way to turn in terms of investing in either increasing in health information system investment or in the provision of services digitally. So again, when you start to see that the ice thaws, so to speak, and you actually see that the efforts that you're putting into start to bear fruit, I think it is really encouraging and really inspiring.
So to some extent, the WHO, at least in Europe, it works a little bit as a sort of coaching, consulting function for digital health, at least in some countries. Would you agree to that?
Definitely. So a lot of what we do is actually to, as requested by ministries of health, we'll go in and perform a specific digital health assessment. So we'll actually look very broadly at the entire health system and the digital ecosystem as it exists. And we'll typically take a very critical stance upon where there are gaps and room for improvement, but also where there are opportunities and what needs to be done at a very macro level to improve the situation as it may be. So yes, it is a consulting role when looked at that perspective, but indeed it actually goes quite far beyond that. So WHO, health being a very political item on an agenda, WHO has a very close role in negotiating a lot of the political discussion that's going on. On a separate segment, it also has a very close role in setting standards. So as a global standard body for digital health, it's actually deeply involved in bringing together the best experts in the world to actually develop or incorporate standards into national health systems. So again, it really has multiple different roles that it actually brings together, both at either the multi-country level or very specifically down at the national level.
And maybe now we can go a little bit in depth into this, the new digital health flagship. So, I mean, maybe tell us a little bit more about the context. Where did this come from in terms of the European program, and why WHO Euro has chosen this focus? Because it's such an important focus in the program.
Yeah, thanks, Enrique. Yes, well, to give a little bit of historical context, so digital health, I would say, is a relatively new priority in terms of public health in Europe, and has been seen by the current regional director, Hans Kluge, as one of 4 major priorities going forth for public health in Europe. That's in line with mental health, with behavioral health, and with infectious disease. So those 4 flagships, as they're called, are really the leading areas in which there's been a call by member states. So it's really answering the call of countries to actually increase WHO's presence. Now, for quite some period, I would say the digital health was maybe not on the top of the priority list. And even prior to COVID-19, there was a general recognition of the strategic value of digitalization. But again, how to do that in a standardized approach, how to do that in such a complex entity as a health system is really a difficult task for many health ministers. In addition, they're also facing a number of drivers that are actually putting stress upon a health system. So we know that issues such as increasing age of European populations, changing profiles of disease, changing areas in terms of health service delivery and demands from populations are all placing different demands on health ministers. And when you look at the seat that they sit in and the different factors that are playing upon their decisions, they really actually benefit from WHO providing consultancy to them and actually leading the discussion for them. So the digital health flagship in essence really links to the European program of work through three major initiatives. The first one is to really begin to pick up standardization of health systems and investments of digital technologies in that respect. So it's about bringing together all of the basic building blocks which have been developing at different rates over a period and trying to standardize them across the different health systems in Europe in the hope that, and with the aim that, then we will have much more standardization at a supranational level and be able to also accelerate the delivery of health services digitally to populations in Europe. The second kind of key strategic objective is really about using data to a much greater extent to improve the resilience of societies in terms of pandemic preparedness and response. And again, we're all sitting in the middle of the greatest example of that in our lifetime. But one of the key lessons we could learn is that our ability to gain access to and leverage data has been, I would say, relatively poor during the pandemic. So part of the key flagship initiative is to really learn that lesson and actually apply it back into countries in terms of increased data governance, in terms of better use and better design of health information systems so that we have not only real or near real-time access to health data, but that we actually understand much better how to analyze and create policy based upon that data. And then the third key objective of the digital health flagship for Europe is really about changing the entire paradigm and the way that we think about healthcare. So as many of you know, health in many ways is very reactionary in the way that it's designed. Many individuals present to a healthcare professional or to an institution really only when an indication of disease presents itself. So part of what we're trying to do is to utilize technology in the broadest possible sense to move from a reactionary care paradigm to a more preventative health paradigm. And this is something that I think public health itself has had as an ambition for decades. But it's really only now that we've moved beyond kind of scratching the surface in what we've talked about in terms of health prevention and behavior change. We're actually bringing in a digital component to it. And that's where I really see the greatest power, that we're actually reinventing health. And I know it sounds very cliched, but we're actually bringing a whole new way into which we look at improving the health and well-being of individuals and the role that data and digital technologies can play in that.
So we already have one or two questions from the audience, and so I'm going to inject already one of them. And this is Nuno Lourenço, who is asking, well, the case of Portugal, but I'm sure other countries may have the same issue, is what do you think about insurers that are to some extent restricting or not very facilitating of payment for telehealth and video consultations? I mean, have you been seeing this thing also happening in other countries? How do you see countries unblocking these type of issues?
Yes, definitely. This is an issue that's not specific to Portugal. Many countries in Europe and beyond actually struggle to have health services provide digitally recognized and reimbursable by health insurance funds. So again, it is an issue. And I think part of the issue is really that the digitalization of health in itself has actually been quite slow to standardize not only the service delivery itself, but the way that that service is actually evaluated. And as a consequence, it's been very difficult for health insurers to actually, in many cases, understand or justify exactly what they're insuring. So it's not unique in a sense to a specific national environment, but it is a problem that we see replicated around different national environments in Europe. So the question is, how do we go about tackling this. And I think one of the biggest issues that one of the biggest approaches that we can have is, first of all, to really, again, begin to standardize across national borders in terms of how services are designed, implemented, and delivered. And I think what that's going to do is to create a critical mass of away from the inertia that we have with health insurers, to try and then allow them to actually be more open to ensuring both, for example, mobile apps and their usage in terms of preventative and continuity of care, but also maybe more innovative services, which I know often lack evidence. So they actually lack the clinical evidence, they lack the clinical evaluation frameworks in order to be able to evaluate them. When you are in that situation, it then becomes a very difficult situation for health insurance to cover. So it is something that we're aware of. And again, I think it's time now that we actually bring together a portfolio of common European digital health services, and then have the insurers wrap around that to see how much they can then begin to insure, and to do that in a standardized way across Europe.
And would you actually see, or maybe it's already happening, that eventually WHO itself could perhaps educate some of these stakeholders, so large insurers or even groups of insurers at the European level, so that they're more aware of what's happening in terms of offering as well?
Well, I'm not actually sure that it's really WHO's role, because I mean, the key constituents for WHO are the health authorities, and they do in a way extend to the national health insurance funds, but they are in themselves a national entity that is at times perhaps beyond WHO's mandate. I think probably where the education, so to speak, will come in is really by strengthening the ability of health authorities to actually deliver the health services. That's not to say that we won't embrace in a more open, more global dialogue on this, but I think that there's probably better ways and conduits to actually improve the portfolio of what health insurers will cover. And WHO's positioning in this is probably best aimed at strengthening the provision of health services through those entities within or under the ministry that are actually designing those services. I think that's probably going to be the best approach there. There are other entities, I think, within the digital health ecosystem that will probably also be contributing to ensuring that health insurers actually have a better understanding and play a bigger part in their role.
We have a long, challenging question on collaboration between WHO and EU, but I'll go back to that one a little bit later. Maybe to ask you, I mean, you touched upon the issue of public health and digital health, and do you think that it's true that now public health and digital health are a little bit more together, but it's maybe not always been the case that they were thought as something that should be together?
Well, I think that's a really, really pivotal question, Enrique. And I have to say they haven't always been together. And in fact, as somebody who's really been invested his career in digital health for many years, I've often seen that there is really a divide in the communities, one that deals with kind of very public health lens that's looking at non-communicable and communicable diseases. It's looking at different burdens of disease. It's looking at certain angles of health investment at a very macro level. And we've seen an enormous rise in a digital health community that's developed very rapidly, even over the past 5 to 10 years. But essentially, these communities, we call them, have developed in somewhat different circles. And as we often see that, we often make the observation that when we attend events that are associated to digital health, we often see very young, very well-educated individuals. And when we attend public health, we tend to see a completely different demographic of person that's attending. On the reality side is that we're working really hard to try and bring these two worlds together. And I think there's definitely a benefit in which we're doing so. And that's actually one of the key factors of the WHO Digital Health Flagship. because the dialogue, the vernacular, the discussion in these two communities is vastly different, and they don't understand each other well. Yet those of us in the middle can really see the benefit of combining the digital communities, the digital health communities, and the public health communities. And again, there are opportunities along the way for these things to combine, but we need to move past kind of very small scale investments into a much greater combination of where digital can work towards public health and where public health can influence the design of digital health solutions. And I think that's going to be a very interesting journey coming up in the next 3 to 5 years, because I can see really that those communities, forced in many ways through the COVID-19 pandemic, are coming closer and closer together.
Yeah. I mean, I would add on that, and so you can rest for 1 minute, that I was doing a study that I was presenting finally on last Friday at the European Parliament on European Center for Data and a public health data strategy. And one of the challenges that I had, so I interviewed quite a number of people from public health, from the European Commission, people from the CDC in the US, Hong Kong. I mean, some of these people are actually part of one of the programs we are going to launch, a digital health program that I'll talk about later on towards the end of this session. But what I found is that definitely COVID was an accelerator, but in many ways, this sort of public administration was left behind. Someone was saying at some point that, you know, we had investments in, for example, in one of the countries, there was massive investment from the government to put IT in hospitals, but not to put IT in the public health departments, and this to a massive difference. And actually, I remember here in Portugal, the budget allocated to projects related to public health was perhaps about 2 or 3 million a year, and projects related to hospital IT and so on would be on the verge of 100 million. You know, when you total all the hospital investments. But the point is that population data, which is what you need to do policy and planning, it does need to be gathered in other ways rather than hospitals. Here, for example, so people know, I mean, we at some point in time, everyone is saying, well, we'll build a patient summary and let's get data from hospitals and data from primary care. So our patient summary, following the EU standard and HL7 standard and so on, actually gathers data from those. So I asked the question to the IT team, you know, from all the summaries that we have, how many summaries have data coming from hospital? And actually, only 1 out of 3 had some hospital data. Because people don't get, you know, well, that's a good thing, but not everyone goes to hospitals. And actually, a lot of health is supposed not to happen in hospitals. And definitely, I think that as people now with COVID have realized how hard it is to move data from care provision to care planning and to public health, hopefully these bridges will, I hope, will be established. And there's a lot of value in that, especially for those that are more interested in AI. So we're going to cover some AI topics also in courses, and AI is quite big. You need data from the population to be able to build your models. Right? You can't build a model without population data. And yet a lot of people think they just get the data from one hospital and build a model. It may not work very well. So on this, one of the questions we got was, quite a long question, but anyway, I'll summarize it, was that more than about half a century ago, Dr. Larry Weed's paper on medical records, that guide and teach, suggested that nations should unify their patient summaries and care records. So why is it that we haven't got there? and to some extent, is it possible that WHO Euro and European Commission develop comprehensive standards for clinical ontologies and terminology? So it's a hard question for you, but I think it's a good one, because I know you're closer now than you were before, but perhaps there are also differences from perspectives that you might share with us.
It's a really, really good question, and it's a topic I'm very passionate about, because I completely empathize. It seems ludicrous in 2021. We don't even at a very kind of peripheral level have an interoperable patient summary across Europe. When on a daily basis we have financial transactions shooting all over the world, how can this be so complicated, especially when this is a problem we've literally been working on for half a century? Well, there are a number of examples, and we could literally use the rest of our time tonight just discussing this, but I'll try to get right to the heart of it. So firstly, there is an ecosystem of standards organizations who have worked for sometimes perhaps not towards a common purpose. So they've been busy developing their own separate technical standards that haven't really contributed to harmonizing the way in which data can and should be exchanged. In many ways, and WHO, and I've been part of these forums, has tried to bring these standardization or standards organizations together, who've been very strong and very vocal in advocating for their own standards to be adopted, but really have agreed to disagree. So they haven't actually reached a point at which on any basic level there's been a common standard for a European patient summary, or for even fundamental data exchange. Now, as certain organizations have gained more and more presence in the standards community over time, then certain standards have begun to emerge, but it hasn't really been according to any, I would say, strategic plan. It's really been a very organic development, and that has taken quite some time. There are also a number of other contributing issues that are not technical. So there are a number of legal issues, both at a national and international level, that I would say serve to prevent harmonization of data exchange. And obviously, when countries already have invested literally millions of euros in existing systems, there's a lot of reticence to actually change those systems to perhaps adopt new standards. And in the absence of any pervading, overarching, either European or international standard, it then becomes a very difficult argument. We know from those cases that have been successful, for example, the exchange of e-prescription data between Finland and Estonia required 2 years for that change in legislation to go through the different national respective parliaments. So again, lengthy processes, lots of legalities, lots of technical standards, but we now know very clearly, and WHO works very closely with the European Commission, and increasingly so on these issues, that the inertia to actually bring these things together is much, much greater. There is also a movement for an international patient summary, which HL7 and other standards communities have actually have been helping with. So where we've moved literally 10 years ago from a very diverse, diverging landscape, we've now turned that tanker around, so to speak, to start to bring together and develop the use cases for what standards in application would be. Now, looking forward, I think that's one of the areas in which within, I'd say 5 to 10 years, and it still is too long in my opinion, but we will then begin to see a much freer flow of information across borders and a much greater standardization on the security and privacy regulations surrounding that. Those factors together, when harmonized with national and international legislation, I think will be a fertile ground then for a much better exchange of information. And here, when it's not limited to individual data, it's also data that is anonymized, that is specific public health data. No matter where it comes from, there's definitely issues with interoperability.
So would you say that actually, if there's a nurse or a pharmacist or a doctor hearing us, do you think if those type of people that have been experiencing interoperability problems and consequences from lack of interoperability, do you think they are missed in those organizations? When you have interacted with some of those SDOs, do you feel there is somewhere there someone that has at least worked a few years with the problem in his hand, or they're coming from some other bureau and they've never experienced the problem? Do you think it makes a difference that we coach digital health professionals to get to those organizations as well?
Absolutely, Enrique, and we don't do enough of it today. There's a much greater need to educate health professionals in digitalization, and to have the community of digital technical professionals actually expanded greatly. There also isn't a lot of certification of some of these education, and that's something that WHO is looking to work with the educational entities across Europe and more broadly. We see time and time again a lot of evidence that both the perspective and the problems at a very granular level that healthcare workers are grappling with on a day-to-day basis are not the types of problems that standards development organizations or even ministries or other health authorities are looking at. So they're looking at essentially solving quite a different perspective of problem, and not the one that really, in my way, is probably the most important to solve. And when we do begin to look at it like that, I think we're going to see then an initiative bubbling up that then brings together a much greater need for data governance and for alignment and standardization across national and supranational entities. And again, I come back to the fact that healthcare professionals should, with confidence, be able to access data on patients where they have the authority to do so, irrespective of where they're placed, and to make sure that that level of transparency also reflects back on the public. There should be availability of personal health records to citizens of any nation. We also see, again, that as the state is, at this point in time, there really isn't yet a cross-border exchange of health services. So even where countries are very homogenous in their cultures and in their legislations and the way that their health systems are designed, we really, even today, don't yet have that cross-border exchange. So again, once we do, then the healthcare professionals, I think, will open up completely different work environment. And we need to make sure that they're ready, both prepared and digitally capable, but also that they understand and are receptive to new innovations when they come into health systems, because that's going to happen more and more and more. And right now, I feel that the health workforce is inadequately prepared to face that innovation wave.
Yeah, I also feel that, but I also feel that we are lacking healthcare professionals sitting on some of the Brussels meetings and some of the Copenhagen meetings more often. So I mean, not necessarily public health, because perhaps those have been in some of the meetings, but I mean, even, primary care doctors, pharmacists from hospitals, and my theory, maybe I will be disproven by time, but my theory is that there was no boost up programs. There was no way that these people could see that there is a career outside provision of care that is called digital health. And I think this career is now starting. We see, at least here in Portugal, we see more and more hospitals appointing. Sometimes it's half-time. There are already some full-time positions as chief medical information officers and chief nurses information officers. Do you, from your experience, tackling with different maturity level countries, very different, in the 53 countries that are covered by WHO Euro, what countries would you point out as countries that have already sort of matured a sort of digital health workforce of this type, in terms of hybrids between professionals and digitals? What are the countries that people can look for in terms of modeling this type of career path?
Well, again, I think it's very difficult to point out any one specific country, but we definitely see that the Nordic countries, including Estonia, have really embraced that level of health worker education. That not only have they made strong investments to ensure that the healthcare professionals, right down to primary care doctors, are well educated and well aware of what possibilities for innovation exist, and are able to incorporate and use that innovation with confidence. But we also see that the dialogue goes from primary care up to the very top level. So it's very much a two-way dialogue. Or I would say, put it a different way, it's a feedback loop that actually works very well between public health and primary care, that actually allows that innovation to flourish. And those are actually best positioned, and I've seen lots of evidence this in the Nordic region in particular, when invested with public-private partnerships. So bringing together kind of the two areas to actually then allow for innovation to be fertilized and cross-fertilized and grow within a health system, but still maintain kind of the public principles. So to kind of answer that question specifically, I think there's a lot more we can do to educate healthcare professionals, irrespective of where they are. What we do see really between this massive geographical region is we see a fundamental difference in understanding of what digital technologies are, and a fundamental difference in awareness of what they can do. When you see a society develop, you see it develop in several ways. First of all, you see it develop in the level of trust for the use of digital services. You see it develop in its level of digital and health literacy of the population, and you see it develop in the level of digital literacy of the healthcare workforce. And again, Northern Europe in particular is an area, but it's not exclusive. We're seeing also Portugal as another example, the UK. But that kind of realization of the areas that need to invest in are growing and growing. So you'll see countries such as Kazakhstan, for example, have already made leaps and bounds to leapfrog up the development curve and actually start to begin that level of awareness and literacy among the population for digital solutions. You find then that the populations then demand more and more of these types of services from their governments. So it becomes kind of a reinforcing loop that's very positive. But it's true that we also suffer from major inequities in access to digital solutions across this huge geographic region. And it is really difficult to actually monitor and manage the differing levels of inequity. So we, again, and quite often it's a situation where countries are starting off almost at a greenfield level, and they're starting to put together very basic elements or components of digital systems. And we have to advise and assist them in ways to do so that's not going to immediately prevent access from the broadest populations in being able to use those digital services. So we have this kind of dichotomy in the European region, that we have some of the most advanced societies in digitalized health in the world, and we have some of the least advanced societies. And really, we see potential for bringing those two parts together and allowing the least developed to leapfrog up the digital health development curve. But I certainly won't hide the fact it's a challenge. It's an inspiring challenge. But I think WHO also has a big role, together with the European Commission and other international partners, to actually ensure that we do that in a way that we share the equity of benefits of digitalization across countries, no matter where they are.
Okay, on that one, so that we sort of make you relax a little bit, what would be, if you can recall, in one of your many trips to any nation in the region, what has been, two quick questions. What has been the most common thing ministries of health want to show you as a proof of digital health advancement, or e-health, which was the old term? And what do you remember as sort of the thing that impressed you most? And you don't have to say the country, but what is the more common one, and what is this, you say, wow, I wasn't expecting to see this. For example, when I was leading the digital agency here in Portugal, and I often went to hospitals in the beginning of my term, so it's 7 years term, but in the beginning, so people didn't know me very well. It was very common for the IT director of the hospital to want to show me the data center. This was super common. It was very, and I always asked them, why are you showing me the data center? I want to see the doctors or the nurses using whatever systems you have. But that was my common one. So I ask you, what is sort of the most common thing at this case ministries would show you, coming from WHO, and what was the one you said, wow, I wasn't expecting this. This I want to take. I would love to see this spreading all over Europe fast.
Well, it's interesting your observation about the kind of the data center, because this I can certainly echo that sentiment. Kind of the shiny whirring machines and the pride invested in having got them running. It's somehow transmuted, I think, into public health data portals. So most often countries are very keen to show WHO the efforts that they've made and the investments that they've begun to develop public health data portals. So these are the classic portals that citizens will use to access their own personal health records, to access services, to make consent choices, etc. That's really the most common area in which countries are keen to demonstrate to WHO that they really are making a difference. So that's usually the first thing that I've shown. In terms of what surprised me most, and it's again difficult to pinpoint one, but I know one most recent one, and it really was during COVID-19, and we have to kind of put this into perspective that it was relatively early on in the pandemic, and as you know, so much was unknown about COVID-19 itself, and we were really learning new science every day. What I felt was really quite amazing was not only the speed at which some people who had been really opposed to telehealth and teleconsultation services completely changed and brought it online. So that was kind of like a big realization that after being stalwarts in essence to say that no, we definitely never can have a digital conversation like we're having today, that the whole motivation for that turned around. And I think just kind of more generally, the speed and breadth at which that change happened was really breathtaking, and not something that I think would have happened otherwise. But one of the kind of, I would say, more innovative things that really surprised me was an AI-based application that was being used by doctors in a rather low resource setting, and was actually relatively inexpensive, but it was an app that was actually being used to monitor vital signs of an individual who was suspected to have COVID. And so it was actually monitoring their oxygen, their heart rate, oxygen saturation, heart rate variability, and a number of other kind of vital signs. Now, this is being used by general practitioners who I think fall into the category that they really weren't digitally well educated. They felt almost a little bit scared of the technology, and yet here they were having patients at the other end of a virtual consultation using their mobile phone to measure their vital signs and having that in real time sent back to a clinician who was then able to advise them on the best course of action. That to me was really a paradigm shift, to see that there was this intense adoption, that it happened so quickly, and that it was a combination of a device, of artificial intelligence, its linkage to an electronic health record, and really bringing it all together to have a whole new paradigm for continuity of care. That I felt was quite a revelation.
As I was listening to you, I couldn't stop thinking, and I think it's interesting for everyone paying attention to us still, that you do need to know a lot about health and about technology to really understand digital health. I mean, you were talking about these details of the hardware, of the software, of the AI, but also of the processes, as if you were yourself a clinician by now. So do you feel a little bit like a healthcare professional by now?
Absolutely, and I would really say to students of digital health that you need in some way to grow into to health, public health, and healthcare. You need to understand how the different parts of the system work together and play together, and technicians typically by their education tend to be problem solvers. So they're looking constantly for how can they apply a problem. But quite often there isn't a simple technical solution. And I think that's one of the key things when you begin to learn a lot more about the clinical side and the challenges the clinical side is facing, and you understand where the knowledge boundaries are and where they meet, then you begin to have a better understanding of how you can really have an impact on solving those problems. If you look at them in terms of just their technology component, then really you're only scratching the surface. You're only getting to half the issue. You need to understand a lot of cultural perspectives, a lot of biomedical perspectives. You need to understand a lot of financial perspectives as well, and policy aspects. So bringing all those things together, I think, makes for a kind of a well-rounded professional who's able to actually provide solutions.
So now I have two questions from the audience that I would rate as geopolitically super hot questions. So you are okay not to answer them if you don't feel you can. They are indeed interesting, I think. One, it's Pedro Subreiro asks a question about, how long do we have to wait until a sort of democratization of patient access to their own clinical data? And we know that within the EU part of Europe, there is the GDPR and there is the rule of law and there is democracy, right? But there's other parts of the region that have different rules. And how easy is it for an office in Copenhagen that extends so far and to such different political environments to really advise at a political level, and in a way to share values from a sort of Western Europe tradition, but in a way that are somehow the values of WHO. And linked to this one, a second one difficult as well, which is a question, which is perhaps Europe needs large EHM, electronic medical record author or company, so that we are not so dependent on the big four from the US. So if this was only a European international organization, I think it would be easier for you to answer. But you have the counterparts, right? You have PAHO, you have the American side of WHO. So I guess Euro cannot say, yeah, let's have a European Google and do that. But in a way, how it's about European sovereignty in terms of data and healthcare IT. I think that we can distill from this question. But over to you.
Well, let's take the first question. So how long to wait for democratization? And I think I don't think it's possible to put a time frame on it, but what I will say is I think the pace at which that is happening is increasing. We already see, again, through efforts of not only WHO, but many international partners, that we really are seeing a more transparent, a more free exchange of technology, whereas previously it was a lot more stilted. It was a lot more bounded by intellectual property rights or standards that perhaps were owned by certain private entities. So we're seeing that, again, the rate at which innovation is having this osmosis is increasing. Still, I really understand the question, because we're not yet seeing the level at which an individual yet has access to a sufficient level of data to be able to use it themselves for their own preventative health, or in very few locations, or that is available ubiquitously across the health system for whenever care needs to be provided. So I still think we have a long way to go before we are in a situation where both data from within and outside the health system is contributing to what I would say an equitable democratization. I think that's quite important that we note that. Before then, we have free access to our own personal health information and the benefits of collective health information, those two things together. But I think it is coming, and it's coming faster than we can probably even begin to imagine here in this conversation today. In terms of a European-centered development as opposed to Silicon Valley or others. I mean, again, Europe tends to have a lot of small to medium enterprises which develop solutions that quite often interface to some of the more global providers. And I think that's a model that's actually both been a plus and a minus across Europe. So it's shown a lot of speed and flexibility, but it hasn't had the same level of reach. We know and we see and are extremely cautious about having large digital organizations moving into the health space, what it means also in terms of data sovereignty. And again, I think the EU is doing a fantastic job through the GDPR and other directives and mechanisms to ensure that European data stays within Europe and privacy principles are actually kept and respected. But from WHO's perspective in the European region, it isn't homogeneous at all. So we have many countries which don't have any privacy protection, for example, or have questionable privacy both within and outside of health. So it really is a task not only to try and show a value proposition to these countries, to show them that it is a positive feedback loop, that once you do establish strong privacy regulation for health data, that allows for a much quicker, much more nuanced development of health services. Then that positively feeds back to a faster and faster generation and a population that becomes more literate and more seeking of such services. So again, I also see evidence of that and perhaps even of maybe an east-west shift as well. So we also see that innovations are coming in the other direction, innovations that perhaps we didn't think about. So it's not necessarily just all one way, but I think that it's really vital that from Europe that we do establish a common values base. And that's what WHO seeks to do, both in terms of having a set of common digital values, but also health systems values that are common across the region and indeed across the world.
Thank you very much. So now we'll have a final question for you. Just after I just briefly put up a slide on some of the courses, so that people are just made aware that over here we are launching in May 2 programs. A program, it's actually in English, but it's taught in Portuguese and in English. It's the advanced program in digital health. This is 140 hours of teaching. It's the first course of this type in Portugal. And it's going to be a course that is sort of a COVID course. So it happens in classroom, but also online. And it has about 28 hours in English. The rest is in Portuguese. So it's sort of open to Portuguese speakers from Lisbon, but also from other parts of Portugal and even from outside Portugal, such as Brazil or Angola, or even in Europe or elsewhere, wherever there's a computer, they can participate. And in one other program that we are taking out from this one is that the interest of today showed us we have more than 70 people that are joining today from around the world, literally, not just from Europe. And this is, of course, no thanks to our brand, but thanks to the quality of our guests today. But still, it made us think if we select these parts of the course, which is about 30 hours of topics in digital health, they may be useful for people and participate in those debates. So that is the second offering that we are launching. So the Boost program is online exclusive one, and it's in English only, so that anyone, as long as they can speak English, can participate from anywhere in Europe and outside Europe, if that's of interest. So these are two pillars of what we are trying to achieve here. And at some point in time, we may think about trying to set up some program with other universities and perhaps with WHO on quality certification for these programs to make sure that they are, I wouldn't use the word certified for them. I would definitely use the word evaluate and check for its quality. So before we finish, and already starting to really thank you for taking 1 hour with us, and thanking everyone for joining us, and the questions that have been sent over through the chat function. And maybe the last minute, and I don't take you more time, and any one of you, how do you see digital health in 2030 in Europe? Clayton, how do you see it? And if you prefer 2040 is fine as well.
Well, 2030 is actually really just around the corner, but I'd say that, let's just say in the short to medium term, I think we're going to see a lot more prioritization on the use of data and a lot more standardization on the way that data is captured and able to be shared. I think we'll see a wave towards more cross-border use of data, so that we'll actually see big, large data sets begin to appear, and we'll see a lot more research done and the benefits of that research feeding back into the public health systems. I don't think it's all about AI. I think AI will be a very important point, but I think that really by 2030, 2040, we will have collectively raised the level of digital health in Europe to quite a reasonably high level. And that populations will then be a lot more literate and a lot more familiar with using digital solutions than they are today. And that we actually have a lot more equity in the way that digital health will be provided. That's at least our hope, and that's the goal that we're working towards.
Thank you so much. I think it was such a short time, huh?
Yeah.
But that's always what happens when we have a nice conversation with an intelligent person. Thank you so much for joining us tonight. Thank you all for joining our session, and stay tuned and in touch so that we all build this digital health Europe space that we have to benefit from as well as build and contribute to. Thank you so much. Have a nice evening. Thank you.